Good day, everyone. My name is Hannah May Ruiz, your student nurse from Nova Ecija University of Science and Technology, and I am here to demonstrate the procedure of administering oxygen by nasal cannula. The goal of the procedure is the patient will exhibit oxygen saturation level within acceptable parameters. For the equipment, check for oxygen delivery device as ordered by healthcare provider, oxygen tubing, consider extension tubing, humidifier if indicated, sterile water for humidifier, oxygen flow meter, oxygen source, and appropriate room signs.
Bring necessary equipment to the bedside stand or over bed table. Perform hand hygiene and put on PPE if indicated. Next is identify the patient. Close curtains around bed and close the door to the room if possible. Explain what you are going to do and the reason for doing it to the patient. Review safety precautions necessary when oxygen is in use. Place no smoking signs in appropriate areas. Connect nasal cannula to oxygen setup with humidification if one is in use. Adjust the flow rate as ordered by healthcare provider. After that, check that oxygen is flowing out of prongs. Assist the patient. Place prongs in the patient's nostrils. Place tubing over and behind each ear with adjuster comfortably under the chin. Alternately, the tubing may place around the patient's head with the adjuster at the back or base of the head. Place gauze pads at ear beneath the tubing as necessary. Adjust the fit of the cannula as necessary. Tubing should be snug but not tight against the skin. Encourage the patient to breathe through the nose with the mouth closed. Reassess the patient's respiratory status, including respiratory rate, effort, and lung sounds. Note any signs of respiratory distress, such as tachypnea, nasal flaring, accessory muscles, or dyspnea.
Remove PPE if used. Perform hand hygiene and document the procedure. Put on clean gloves. Remove and clean the cannula and assess for nares at least every 8 hours or according to agency recommendation. Check nares for evidence of irritation or bleeding.